Hello, my name is Alyssa Thompson. I'm the Academic Coordinator of Clinical Education for the Mercy College PTA program. First of all, I would like to thank you for volunteering to be a clinical instructor for our program. I appreciate your willingness to serve in this role. I've created this very brief PowerPoint recording to provide an overview of PTA 163, Clinical 1. The goal of this PowerPoint is to familiarize you with this clinical course and help you to have a deeper understanding of the student coursework completed in the PTA program prior to the start of this clinical experience. First, I will provide a brief overview of PTA 163. PTA 163 is an integrated clinical course. What this means is the course is not a full-time experience. It occurs in coordination with other coursework. This clinical occurs in semester 2 of our program. The clinical takes place in January and February. This experience is a total of 40 hours, 8 hours per day times 5 days, occurring on Fridays. In semester 1, the students have completed the classes listed on the screen. I will further discuss the knowledge and skills the students have prior to the clinical in the next slide. The students who are starting PTA 163 have knowledge and skills in the following areas listed on the slide. What this means is they have successfully completed all assessments, including quizzes, exams, skill checks, and practicals related to this content. These are the areas and skills in which they should be practicing on this clinical experience and should be the primary focus of this particular clinical. Due to the fact that this clinical occurs early in the curriculum, there are skills the students have not completed at this point. Our therapeutic exercise and modalities classes occur in conjunction with PTA 163. Therefore, the students are working on the skills listed on the left, but have not been assessed for clinical readiness in the classroom. The students have not had musculoskeletal or neuromuscular coursework at this time. Therefore, they have limited knowledge base in those content areas. Although they have already completed their pathophysiology course, the application related to physical therapy has not been covered at this time. Please note as a clinical instructor, if you choose to have your student or students practice skills which have not been evaluated in the classroom, you take full responsibility and liability for those skills which you are having the student perform. Prior to the start of this clinical rotation, you received an email with a link to our clinical resources page. The link is also listed on this slide. This is a great resource that has a large amount of information to answer questions that may arise during clinical. I'm also available to answer questions or provide resources as needed. Please feel free to reach out to me if you have any questions before or during the clinical experience. Again, thank you for volunteering your time. I appreciate your dedication to our students and look forward to working with you.